everyone. It's a pleasure to be here. So today we will discuss about syndromic surveillance, which is a specific type of surveillance that is distinguished by the case definition. So specific definitions for syndromic surveillance are really lacking, and the name itself is quite imprecise. Many different names have been used to describe public health surveillance systems for early outbreak detection, such as early warning system, prodrome surveillance, outbreak detection systems, information systems based on sentinel surveillance, biosurveillance systems, health indicator surveillance, and symptom-based surveillance. However, syndromic surveillance is the term that has persisted over time. Perhaps the most comprehensive definition to date, and likely the one to be broadly adopted, is provided by CDC's evaluation framework, which describes syndromic surveillance as an investigational approach where health department staff, assisted by automated data acquisition and generation of statistical alerts, monitor disease indicators in real time or near real time to detect outbreaks of disease earlier than would otherwise be possible with traditional public health methods. And in here, do note the term in real time or near real time to detect outbreaks of diseases earlier, highlighted in red. Another definition, which is very similar to the overall definition of surveillance, it's the ongoing systematic collection, analysis, interpretation, and application of real-time indicators for disease that allow for detection before public health authorities would otherwise identify them. So syndromic surveillance data are collected in real time, meaning that the data are automated so that they can be received daily or even more frequently. And the type of data collected is not actual disease. Instead, we are interested in specific indicators of disease. In these two definitions of surveillance above, you'll probably notice that the definition of syndromic surveillance is very similar in ways to the definition of surveillance in general. It's ongoing and systematic collection. There's analysis and interpretation of data involved. However, the time component and the type of data collected are different from passive or even active surveillance. It's real time or near real time. The Oxford Dictionary defines syndrome. So we talk about syndromic surveillance. So what is a syndrome? So the Oxford Dictionary defines syndrome as a group of symptoms which consistently occur together or condition characterized by a set of associated symptoms. Last 2021 defines a syndrome as a symptom complex in which the symptoms and/or signs coexist more frequently than would be expected by chance on the assumption of independence. In surveillance, a syndrome is a set of non-specific pre-diagnosis, medical, and other information that may indicate a disease outbreak. The symptoms may be specific but not require laboratory confirmation for diagnosis. Syndromic surveillance thus focuses on early event detection, gathering and analyzing data in advance of diagnostic case confirmation to give early warning of a possible outbreak. Such early event detection is not supposed to provide a definitive determination that an outbreak is occurring. Rather, it is supposed to signal that an outbreak may be occurring, indicating a need for further evidence or triggering an investigation by public health officials. More recently, syndromic surveillance has been expanded to include using existing health data in real time to provide immediate analysis and feedback to those charged with investigation and follow-up of potential outbreaks. Moreover, a broader focus on electronic surveillance enables inclusion of both early detection and situational awareness. So some of these symptoms that are some of the syndromes that are monitors within a syndromic surveillance system can be grouped as follows. So acute flaccid paralysis, also known as AFP, a syndrome potentially indicative of poliomyelitis, so polio. Influenza-like illness, ILI, a syndrome potentially indicative of SARS and similar influenza-like novel diseases. Acute fever and rash, or AFR, a syndrome potentially indicative of measles. Prolonged fever, PF, it could be indicative of a novel disease out there, as well as gastrointestinal illness, GI, can also be very useful syndrome to monitor. So now we'll be going over very briefly in this group of syndromes that we just talked about, just introduced. So what is acute flaccid paralysis? Acute flaccid paralysis. So acute flaccid paralysis is a symptom potentially indicative of polio, but it can also be associated with enterovirus, West Nile virus, adenovirus, and as you can see in here, it can also be associated with many cases of HIV, tick bites, snake venom, and rabies as well. So in the 1980s, the goal of eradication of polio resulted in acute flaccid paralysis surveillance being implemented globally as the key surveillance measure for the eradication of polio. So that's how AFP had been more associated with polio outbreak. The next one that we briefly introduce is influenza-like illness. And influenza-like illness is another very important syndrome that is monitored in syndromic surveillance systems. In this table, you can see InfluenzaNet, flu tracking, Reporta, flu near you, or Salud Burikua. And these are some of the syndromic surveillance systems that are out there that specifically look at this syndrome, influenza-like illness, happening in the community where they're monitoring, or in the region where they're monitoring. So influenza-like illness, or ALI, also known as acute respiratory infection, ARI, and flu-like syndrome, is a medical diagnosis of possible influenza or other illness causing a set of common symptoms such as SARI, referred to severe acute respiratory infection. And you can also see the ICD-9 codes in here. And so mostly focusing on acute upper lower respiratory tract infections and viral disease symptoms in general. Prolonged fever, or PF, is also looked at more specifically in syndromic surveillance system. And it's a rare systemic disease, the specific PF, and is characterized by febrile illness, body temperature greater than 38.3 degrees Celsius on several occasions, or inflammation, elevated serum C-reactive protein and erythrocyte sedimentation rate, lasting at least so inflammation and fever lasting at least 3 weeks, and for which no specific diagnosis is achieved despite extended diagnosis. So in the table to the right, you can see the definition of fever of unknown origin, and you can see in here various definitions of such fever, as well as prolonged fever, which can connect to a potential new type of disease out there. So it's worth looking for that specific syndrome. Acute fever and rash, or AFR, it's a syndrome potentially indicative of measles. And in this table, you can see that other possible illnesses are also associated with acute fever and rash. But in general, outbreak of measles has been closely associated with AFR. So the goals and rationale of syndromic surveillance can be depicted in here. So we know that when we have an illness, we have this period where you have the incubation period, and then slowly the symptoms starts rising until it becomes um, uh, um, um, serious, and you have the full-blown illness. And then depending on the type of illness, you start recovering, and the symptoms starts declining over time after the recovery period. So in typical surveillance system, once the symptoms starts becoming more and more severe in the general population, you start seeing more and more cases out there, and then lab diagnosis would follow and so forth. And you start seeing the rise of cases in the general population once a significant number of people have reached this severe illness phase. In syndromic surveillance, on the other hand, you start looking at the same types of symptoms that are known as syndromes. And because you are looking at a specific syndrome and you're looking for those specific set of syndromes, as soon as you see enough cases of those symptoms arising, even when there's no specific illness diagnosed in general or laboratory and sample analyzed, just the set of symptoms occurring together can give you a signal that you can look for, and this signal will happen T days earlier than the beginning of the severe illness general occurrences. So you gain this T time, which can be 2, 3, or even 4 extra days of time. Again, so the syndromic surveillance would be looking for specific syndrome, and you'd be able to gain some time as compared to the overall diagnosed illness, where it is looked at typical surveillance system. So this would be like the notifiable disease reporting that are typically done at the national level, community level, whereas the syndromic surveillance would look at specific syndromes, and once the number reaches a specific number, it would give you a signal that something is happening in this community, and you need to look at this further in more detail. And this extra time that you gain, it's what the main goal and rationale of syndromic surveillance is. So potential data sources are shown in this table, and we can also see from previous slide as well. We can have some idea. So strictly defined, syndromic surveillance gathers information about patients' symptoms, so cough, fever, shortness of breath, etc., during the early phases of illness. However, in practice, certain syndromic surveillance systems collect surrogate data indicating early illness, such as school absenteeism or work absenteeism, or over-the-counter medication sale that would be indicative of a specific health problem out there. And by looking at that specific data set, you'll be able to understand what's going on. So the data sources are this type of data sources. And there are also these alternative data sources have low specificity, however, high probability of influencing factor, and sometimes it can also be difficult in retracing specific data. But despite some of the problems that you may have with that data that you're looking at, the system would be able to not only integrate some of these alternative data sources, but also like combine with existing data and lead to investigation that can that you can gain high confidence of what you're looking at. So syndromic surveillance systems have been implemented since the 1990s, initially with the focus of bioterrorism event detection. So the anthrax outbreak after Bacillus anthracis spores were released to the US mail systems in 2001, accelerated the implementation of syndromic surveillance systems across the United States. Syndromic surveillance was developed for early detection of a large-scale release of biological agent, thus aiding in terrorism preparedness. And you can see in here some of the pictures of the specific mail that were received by some of the senators in the U.S. during that time frame, and inside the mail, spores of anthrax was present, and that led to a rise of syndromic surveillance with a focus on bioterrorism. So, with respect to bioterrorism agents, we briefly introduced anthrax. Anthrax, it's a very deadly disease. So there's significant high mortality, and it also disseminates easily, and it needs special action. So the agent, such as similar to anthrax, are categorized as category A bioterrorism agent. You also can have category B or category C bioterrorism agent, which are shown in here and explained in here. So the trend in syndromic surveillance can be seen in here. So we saw a significant increase of syndromic surveillance with the rise of bioterrorism right after the 2001 US mail anthrax spore attack. And you can see in here, rise of bioterrorism, rise of the surveillance system, the syndromic surveillance systems, and that continued on as bioterrorism started declining over time. The syndromic surveillance system in general also started declining because there was so much focus on bioterrorism. However, with the rise of influenza in 2003, 2005, as well as 2009, we have been seeing more and more flu-like pandemics out there. The syndromic surveillance system in general started shifting their focus from bioterrorism, which is depicted in here, to more following the influenza outbreaks out there and being able to predict them earlier. So we are seeing that syndromic surveillance have actually quite adapted itself by not only looking at bioterrorism, which are still evident and present out there, but also looking at influenza and influenza outbreak and similar diseases, which as a result, we're seeing a rise of syndromic surveillance interest all over the globe. So the major usage of syndromic surveillance are shown in here. So early detection of large-scale release of biological agents aiding in bioterrorism preparedness, early detection of outbreaks in general. Also, another use is to follow the size and spread and tempo of outbreaks. Also to provide reassurance that an outbreak has not occurred, particularly in times of enhanced surveillance during a high-profile event, for example. Also to monitor disease trend. Syndromic surveillance are used. So an example of syndromic surveillance is shown in here. So we see a syndromic surveillance system in here integrated with other types of services in the specific area of the world known as the Pacific Public Health Surveillance Network, PPHSN. And this PPHSN is located in the Pacific Ocean, and I'll show a map following in here. And it's composed of 6 specific services, and among them, one is syndromic surveillance, which is shown in here. And the syndromic surveillance system within this larger network in the Pacific Islands is known as the Pacific Syndromic Surveillance System, or PSSS. And it was created in 2010 and is part of the WHO Surveillance System and Response Program that assists countries with strengthening infectious disease surveillance and response system. And thus is part of IHR, or International Health Regulations, and it helps to meet core capacity of IHR. In this system, you can see the various islands out there, and here right there you can see Australia and all of these 22 some countries or island countries that are scattered all over the Pacific, in and near Australia and around that Pacific Ocean area, that together they form this surveillance system and network. So looking at the specific surveillance system in the Pacific, here is a map that is viewable to the public. You can focus right here. The Solomon Islands, for example, currently has one alert, and this is from 28 November 2023. So one alert happening. You can click it here, and then you can see what's going on. At the same time, in here, we also see one alert in the French Polynesia. You can click in here and you can see that there is increasing coronavirus disease 19 currently in the French Polynesia. Right here, there's three alerts. Currently, you can click in here and you can see that three alerts. One is leptospirosis, the other is typhoid fever, and then the other one is diarrhea or diarrhea-like symptoms. So if you look at leptospirosis, you can see that is increasing, and the last update happened in October 2023. So this type of network gives you real-time information of what's going on at any parts of the Pacific Ocean, especially in some of these islands. And it helps you to quickly respond if you see a pattern of some common syndromes that you are trying to watch for. So the PSSS in this zone uses existing health systems, voluntary participation, and cooperation in surveillance in order to provide early warnings of emerging health conditions for the Pacific Island countries shown in the previous slide. And syndromic surveillance in this system is based on data that can come from the following sources, both indicator-based as well as event-based. So the indicator-based, essentially where you are looking at indicator diseases of standard case definition that all of these Pacific Island countries have agreed to surveil. And the event-based sources, it's reporting unusual and unexplained occurrences of illnesses or death in the geographic regions or in human, animals, and livestock population. So this is more syndromic surveillance based, and this is more like traditional surveillance based. And the combination gives you a good understanding of what's going on. In here, you could see the specific syndrome that this surveillance system in the Pacific is looking at. So we talked about AFR, acute fever and rash, prolonged fever, influenza-like illness, diarrhea, suspected dengue, as well as SARI and COVID-19, for example. And the specific case definition that applies to these syndromes, and then when the system would send you an alert, what signal. So in this case, for example, just a single case of AFR would give you an alert. Twice the average, the number of PF or prolonged fever within a 2 week period would give an alert. And then twice the average number of cases seen in the previous 2 weeks of influenza-like illness would give you an alert, and so forth. So essentially, you can see that you have this automation going on, through this electronic surveillance system. You can quickly gather this information, data, and you have the alert, and you can act based on that. Alerts that you're getting, and investigate more further whether it warrants deeper understanding of what's going on. So I hope that you've been able to understand what syndromic surveillance is, and thank you.